HIPAA can sound like a mountain of rules. But for most healthcare practices, it becomes much easier when you see it for what it really is. A checklist for protecting patient information and being ready when something goes wrong. Why does that matter? Because HIPAA is not just about avoiding fines. It is about trust. Patients share the most personal details of their lives with you. They expect that information to stay private, stay accurate, and stay out of the wrong hands. The good news is this: HIPAA compliance is not one giant task. It is a system of smaller habits. And once you understand the system, the checklist starts to make sense. A simple way to think about HIPAA is this: who can see patient information? Where can they see it? How is it protected? And what do you do if there is a problem? Almost every requirement fits inside that frame. Start with administrative safeguards. This is the management layer. It asks, do you know your risks, your people, your vendors, and your process? Here, you conduct a risk analysis to identify threats to electronic protected health information, or EPHI. You assign a security officer. You decide which employees get access to what. You train your workforce. You create procedures for incidents, backups, and recovery. And if a vendor touches patient data, you make sure there is a business associate agreement in place. Think of administrative safeguards as the rules of the road. Without them, everyone is driving, but nobody knows the lanes. Next are physical safeguards. These protect the places and devices that touch patient data. That means controlling access to offices and server areas, positioning screens away from public view, locking workstations, tracking laptops, phones, and drives. And when equipment is retired, making sure patient data is securely removed before disposal. Then come technical safeguards. This is the technology layer. Every user should have a unique login. Access should match the person's role. Systems should log activity so you can see who viewed what and when. Sensitive data should be encrypted, especially when it travels across open networks. Sessions should time out. And identity should be verified, often with multi-factor authentication. In plain English, technical safeguards answer one question: can the right people get in, and can the wrong people be kept out? HIPAA also includes the privacy rule. This focuses on how protected health information is used and disclosed. Patients need a clear notice of privacy practices. They have rights to access records, request amendments, and understand certain disclosures. Your team should follow the minimum necessary standard, which means using or sharing only the information needed for the job at hand, not more. And then there is breach notification. This is the part no one wants to use, but every practice needs. If patient information may have been exposed, you need a process to identify the incident, assess the risk, document what happened, and notify the right people within the required timeframes. Do not build your emergency plan during the emergency. One more piece ties all of this together: documentation. In HIPAA, if a policy exists only in someone's memory, it does not really exist. Policies, training records, risk assessments, vendor agreements, audit logs, investigations, and reviews all need to be documented and retained. Compliance is not just what you do, it is what you can prove. Now let's make this real. Imagine a small dental practice hiring a new receptionist and adding a cloud-based scheduling tool. The checklist helps the office ask the right questions. Does the receptionist need full chart access or only appointment data? Has training been completed? Will the new software handle PHI? And if so, is there a signed business associate agreement? Are logins unique? Are screens visible from the waiting room? Is data backed up? That is what a good checklist does. It turns vague anxiety into specific action. And that is why many practices use tools like HIPAA Agent. Instead of managing everything through scattered spreadsheets and old binders, they centralize policies, training, vendor agreements, evidence, and ongoing monitoring in one place. The goal is not to replace judgment. It is to make the work visible, consistent, and easier to maintain over time. Because HIPAA compliance is never really done. Staff changes, vendors change, software changes, threats change. A practice that was compliant last year can drift out of compliance quietly, one shortcut at a time. So here is the takeaway. HIPAA is not a pile of paperwork. It is a living, operating system for protecting patient information. Administrative safeguards tell your team what to do. Physical safeguards protect the spaces and devices. Technical safeguards protect the systems and data. The privacy rule governs how information is used. Breach procedures prepare you for the worst. And documentation proves the whole system is real. Once you see HIPAA that way, the checklist stops feeling overwhelming. It becomes a map. Protect the patient by protecting the process.